Hello, welcome to our channel. We would like to say, you will motivate us to make more and better videos about the relationship between nutrients, medication and diseases by subscribing our channel. And, you will contribute to increase the knowledge of others by sharing them. We appreciate you in advance. This video describes the effect of vitamin D deficiency on multiple sclerosis or MS disease. Vitamin D is a fat-soluble vitamin which acts like a hormone. The main sources of vitamin D include sunlight, fatty fish like salmon and mackerel, shiitake mushrooms, egg yolk, cod liver oil, and supplements. If you see or hear the name of calcitriol among your medication, it is the active form of vitamin D for human body. Diet is a poor source of vitamin D, providing only 40 to 400 IU per food serving, whereas whole-body UVB exposure for 20 minutes for a light-skinned person during the summer months will produce upwards of 10,000 IU of vitamin D. It is essential to remember that too much sun exposure can burn the skin and potentially lead to skin cancer, so sunscreen is needed, although it reduces the vitamin D production by the skin. Some sunscreens are more effective with powerful broad-spectrum UVA and UVB protection. It is important to select a sunscreen with the ability of UVA and UVB protection since both harm your skin. Why? UVB rays penetrate the outer layer of skin, causing damage to skin cells. They are the primary cause of sunburn, and they may be directly linked to skin cancer. UVA rays can pass through window glass and penetrate deep into the layers of the skin that contribute to premature signs of aging, including fine lines and wrinkles. Too much exposure to UVA can play a role in skin cancer. If you like to take advantage of the first sunscreen on the market to prevent skin aging, sunburn, and skin cancer, click on the link in this video description. Higher vitamin D levels are associated with a reduced risk of multiple sclerosis. It is also related to reduced clinical activity in established MS, including decreased risk of relapse and reduced disease activity on brain MRI. What happens to occur multiple sclerosis? It is a chronic autoimmune debilitating disease in which immune cells attack myelin, resulting in demyelination of nerve cell in the brain and spinal cord. Myelin is a fatty substance that surrounds and insulates healthy nerve fibers to ensure fast and effective nerve impulse transmission. The damage disrupts nerve communication with the body. MS is a leading cause of disability in young adults and is the most common inflammatory disorder of the brain. What is the role of vitamin D in occurring and developing multiple sclerosis? Vitamin D deficiency prevents inflammatory demyelination by immunomodulatory and anti-inflammatory action on nerve cells. It reduces pathogenic and aggressive T lymphocytes and leads to a balance between different kinds of immune cells or cytokines. That's why it can reduce inflammation, which damages nerve cell myelin. Interestingly, vitamin D directly stimulates the production of a major MS genetic risk factor called HLA-DRB115. The more HLA-DRB115, the less aggressive T cells. Low vitamin D level in early childhood decreases the production of HLA-DRB115 in the thymus. Consequently, more aggressive T cells could emerge in the immune system of people with low vitamin D in their early childhood, and they will be at higher risk of multiple sclerosis. We should not allow our body experience vitamin D deficiency so that it can conduct our nerve cells to inflammatory demyelination. To prevent deficiency symptoms, eat vitamin D-rich foods regularly, get enough sunlight or take supplements in consultation with your doctor. It is better to choose oil-based supplements, because vitamin D is a fat-soluble vitamin. Noticeably, consuming vitamins and elements more than tolerable upper intake levels is harmful and toxic, according to Food and Nutrition Board, Institute of Medicine. The recommended dietary allowance of vitamin D is 600 IU or 15 micrograms, and the maximum acceptable daily intake is 4,000 IU or 100 micrograms per day. If you like to get one of the best oil-based vitamin D supplements, click on the link in this video's description. Please remember to subscribe. Thank you.